Coming up, we'll get right to our interactive topic, a new Medicare policy that many say could save lives and millions of dollars.
Joining us to talk about Medicare and the plan for them to stop paying hospitals for patient mistakes is Bill Levinson. He's a quality management consultant and member of the American Society for Quality. Also, Paul Lyon from the Committee for Justice for All.
Will this policy change in Medicare increase patient safety, or will the hospitals find a way around the new Medicare rules?
Give us a call to weigh in. The discussion begins right after the break. Welcome back. Our interactive topic tonight, a new Medicare policy that has hospitals on the defensive. Here to talk about is Bill Levinson. He's a quality management consultant as well as a member of the American Society for Quality. And also Paul Lyon from the Committee for Justice for All. Thank you, gentlemen, for being with us this evening.
Thanks for having us.
Both of your groups and many consumer groups are very supportive of this measure as Medicare makes this change in October of 2008 because it stops rewarding hospitals for doing some things that they could be prevented. They get paid twice to take care of problems that they created.
That's correct. We have the only healthcare system in the world that rewards poor quality, and I don't mean to denigrate the quality of healthcare or in any way say that people aren't doing their jobs. I believe that healthcare professionals in our communities and across the country try to do the best they possibly can for their patients. Having said that, if your 3-day hospital stay for your elective surgical procedure turns into a 30-day hospital stay because you pick up an infection while you're in the hospital can bill for that time. And Medicare and the taxpayers that fund Medicare end up paying the tab for that. Medicare has now said, enough's enough. This list of things, preventable errors and infections, we're not going to pay the tab for anymore.
Bill, how much has this been costing taxpayers?
The estimates I've seen range from a low of 30% to a high of 60% of every healthcare dollar is being wasted on the cost of poor quality. This is wasted on activities that are of no benefit whatsoever to patients or even to doctors. In addition, these medical mistakes, and they aren't all mistakes made by doctors, let's be clear on that. There are system-related deficiencies, that is the system in which the doctors have to work, create probably 80 to 85% of all of what we know as malpractice incidents, and this is running up the doctors' malpractice insurance costs as well.
Our viewers have a lot of questions on this. Let's go right to the phones. Carolyn from West Pittston, thanks for joining us.
Hi.
Hi, Carolyn. What's your question or comment tonight?
Okay, my comment is I don't feel that it's going to benefit the patient in the long run if Medicare doesn't or decides not to pay the hospital. This is going to give Medicare patients who depend on their Medicare for their health and welfare, and it's going to be a problem. If Medicare doesn't pay, who's going to pay? Is it going to be the patient? And I just feel in the long run there should be another solution to this.
The new Medicare rules actually say, they stipulate that the additional costs of care cannot be passed along to the patient. The patient cannot be forced to pay for those costs. And that furthermore, that Medicare cannot, or Medicare, hospitals that take Medicare cannot refuse to treat someone who may be susceptible to certain types of infections.
But there is a concern among hospitals, and we did invite some area hospitals to be on the program tonight. They either could not or declined to be with us this evening. But they say in order to fight these infections, they make sure they don't get them at the hospital, they're going to need to do extra tests on patients when they come into the hospital. That's going to cost some money. Medicare pays a fee per patient. So will it go to the other patients of the hospital who have insurance that's not by Medicare? Where will these costs be passed down to?
Those are all valid questions for hospital administrators. Unfortunately, none of them wanted to join us tonight. We are concerned that who is going to end up paying the tab for this. Some consumer groups have expressed concern that hospitals will start doctoring codes on charts and so forth to try to evade, to make it look like it's another condition that's not on the list, to try to get payment from Medicare. That's a concern. I mean, at the end of the day, we're concerned that the responsibility is going to end up coming back on the patient in one way or another. that hospitals are not going to end up picking up the whole tab for this. Because the tab, frankly, if you consider the scope and scale of preventable medical errors and hospital-acquired infections, the tab for hospitals could be significant. I mean, we're talking millions of dollars, potentially even affecting their long-term viability.
You're talking millions of dollars, but why is it the Bush administration expects to save about $20 million on a $400 billion Medicare budget? Why so low?
I can address that. I think it'll be more than that. These costs, as I said, the overall costs are 30 to 60% of every health care dollar, so we're talking a potential out of a Medicare budget, I think it's $400 billion. We're talking anywhere from $120 billion to $240 billion, and I don't know why the Bush administration said only 20 million. Perhaps they don't understand the total magnitude of the problem. Now that's not going to happen up front. That's the total potential savings, and the first level of savings I would expect to be perhaps in the billions. I think the administration understated that $20 million figure, but I think in the end it'll be a lot higher. If I can add something to the viewer's question about whether this will hurt patients by taking money from hospitals, the present policy is hurting patients because right now there's no consequences for hospitals failing to follow generally accepted practices.
Yeah, right now they're rewarded. They get paid if they have to do extra work on someone getting sick from something that they contracted in the hospital. Let's go to the phones again. We do have Anonymous from Milford on the line. Thanks for joining us.
Hi there. I'm a retired nurse, and I did work hospitals, and I would like to mention I almost lost my brother due to a nosocomial infection. That's an infection that is from the hospital. In other words, it wasn't that you came in with it. You developed it in the hospital. I noticed that doctors and the equipment, the doctors, number one, don't wash their hands between patients. I've actually had to see my brother, he'll say, go wash your hands before you touch me. There's the stethoscope, never washed. Okay, that goes from patient to patient. Then you have the blood pressure cuff, goes from patient to patient.
All right, we're going to talk about some of the steps in a moment. Let's also squeeze in Brian from Mifflinburg. Brian, thanks for being with us.
Yes, hello. I was just wondering what the federal government is going to do here. Is that going to affect the patients, though, for what they have to pay? Who's going to pick up this cost? I mean, if the Medicare don't pay it, I would assume that the medical people are going to throw it on the patient.
Well, my understanding, the Medicare patient won't have to pay it, but it might be redistributed elsewhere.
Yes, that is a concern.
All right, we'll talk about what we'll need to keep an eye on in the future and some of the simple practices here that can be taken to make sure these infections don't spread. When we return, it's time for us to take a break. Welcome back. Our interactive topic tonight, a new Medicare policy that has some hospitals on the defensive. They're not going to pay for hospital errors, and that happens more frequently than one would hope.
Absolutely. I mean, the issue of preventable medical errors, hospital-acquired infections, and all the other types of things that make people sicker, or injure, or kill people in the medical setting is, frankly, an epidemic in this country. And just to give your viewers some sense of the scale and scope of this, the CDC estimates, as we saw in the graphic earlier, that 90,000 people die every year because of hospital-acquired infections. The Institute of Medicine estimates that between 44,000 and 98,000 people die due to preventable medical errors. Health Grades, another organization, has said that number could be as high as 195,000. So we'll split the difference and say it's 100,000 people due to preventable errors, another 90,000 people die due to hospital-acquired infections. That is the equivalent of 3 jumbo jets crashing every day in America. Now, if 3 jumbo jets were crashing every day in America, you can rest assured that the government would step in and do something about it because it would be a huge public safety issue. But yet we don't hear the same kind of, we don't see the same kind of urgency with respect to patient safety issues. Now Medicare is finally drawing a line in the sand and saying, enough's enough. We have to stop this stuff, guys.
Of course, we're going to have to watch it and see how it plays out.
Right.
And see if the expenses don't go back to the consumer and the patients. Let's go to the phones. Michael from Larksville. Thanks for being with us, Michael.
Good afternoon. How you doing?
Good. What's your question tonight?
Well, I just want to let them know about the sub-conditions of these hospitals. And I worked construction all my life, and I high construction, doing everything heavy. In year 2000, here in Wilkes-Barre, I got operated on, and I ended up in a local